You get lots of bits of advice as you're going through training, but the one that really stands out, and it says more about what I was like as a young hot-headed trainee, was a good friend of mine, Professor Peter Thomas, who said, "Now, Rhidian, whatever you do, never resign unless you've got a job to go to." And, you know, there are moments in your career when you're just not enjoying the job. You think, I've had enough of this, I'm leaving. And you've got to think about the long term and have some perspective. And I'm sure Peter was sort of having a quiet word in my ear personally. I think he was afraid of what I was going to do. But that stayed with me all my career. And, you make the best of the job you're in. And then it always works out. That's a great question. I'd love to say we are, but every step forward we make, then bacteria, viruses, fungi are getting cleverer. They're getting more resistant. So I think we have to be very careful about what we're trying to offer patients. And in the UK now, we're moving, certainly in England, towards a revision knee network. So we have a central hub that deals all really complex cases, including the infections. Revision hospitals who do a lot of good revision work, and then primary hospitals do phenomenal primary arthroplasty work. And by centralizing the expertise and the care, then I think we're all going to get better at what we're doing, and in particular managing infection. And if you really get the best outcome the first time you deal with infection, and whether you do it through a 1-stage, a 2-stage, a DARE, isn't really the argument. It's about doing it really well the first time you get an infection. And I look at my data, and no matter what I do, I can give you a 91%, 92% success rate. But then that last 8 to 9% gets more difficult because I couldn't clear the infection. So I think we're getting better at funneling patients to where they should be. And if we do that, surgeons get more experience, and hopefully we're going to do better. But we're not going to cure everybody. And anybody who says that they can cure all infections, frankly, hasn't done enough of this stuff. Because I'm still learning, and I'm 25 years into this career. The bugs are pretty clever. You'll say that in the past tense, it's not. And that's one of the problems with infection. Those ones you can't cure, they're yours forever. And I'd love to have a colleague I could just pass the buck to. But the people I get advice from are doing exactly the same sort of work I'm doing. So although I always talk with colleagues, it's very hard for me to send people elsewhere. So I've got patients who are with me for life, and they're ones I can't cure. And yet you learn from them. You learn about managing the patient. Even if you can't cure the infection, you talk about pain management, you talk about comfort, you talk about dressings, you talk about their independence, mobility, you make sure that they are sleeping well, you make sure that the wound isn't smelly, there's lots of things you can do as a clinician. And even though I failed as a surgeon, I haven't got rid of the infection, there's still a job to do. And I've got 3, 4, maybe 5 patients in that category that really I can't do anything for, but I see them, I talk to them, I try and give them a shoulder to cry on occasionally because it's hard. And that's, I think, the greatest value I do. It's almost with my failures, where I'm still trying to be a good clinician. And if there's one message to all the trainees out there, look, your successes will leave you. Every single great operation you ever do will leave you, and you're only left with your failures. And that's not a bad thing. We all get operations that aren't successful, and you've still got to, shoulder that responsibility. Be the right person to look after them. And if there's another person with new techniques, better experience, don't be afraid for a second opinion, but manage patients as a clinician and not just a surgeon. Again, there's this thing about, is my job to cure everybody? Well, I need to try and cure everybody, but when I can't, it's about managing it. And we can't just keep giving antibiotics. So there's a technique that my colleagues in the endo clinic in Hamburg talk about, not very often, because they always tell you that we do everything 1 stage, but they get a 80-something% success rate, and they do it in everybody. But 1% of their cases is managed by fistula persistens. So basically they create a sinus, they let it drain. And if you've got an infection that drains, It's a low pressure environment and the patient remains well. Yes, they've got a wound to manage, but as long as they have a stable implant so there's no pain, it's just a dressing issue and they're off all antibiotics. And that's something that I've learned to accept as a reasonable outcome for the worst cases. So in terms of conservative management, it's not just giving antibiotics. Sometimes it's just, letting it drain, letting nature do what it would do normally. Before surgeons try and cure things, what nature would do would produce a sinus. It would decompress things. And that actually is a very reasonable option for the worst cases. For me, it's interesting. Anybody young, in the 20s and 30s, listening to this rubbish I'm talking, look at your mum and dad, okay? Because I guarantee when you get to your mid-50s, you will become your mum or dad. And I'm my dad now. I'm potting in the garden. I've just built a greenhouse, I'm doing cuttings, I'm putting seeds in, things that I thought were just dull and boring, and I have a lawn I look after. And so these boring things, actually, the garden becomes my mental health clinic. I'm in there getting my hands dirty. And a good weekend for me is gym in the morning, garden for a big part of the day, and then a really nice glass of red afterwards. So, whilst I'm gardening, my wife will come out and give me helpful suggestions as to where I'm going wrong in the garden. And that's always welcome. So you sent me this question, and movie, I honestly don't know. It's in the moment. My favorite movie at the moment is Barbie. My wife took me to see it, and I've got 2 daughters and a son, and my daughters are so proud of me going to see this because the writing, the acting, the messaging in this pink fluffy bit of celluloid is amazing. It's a real feel-good film. So my favorite film is the one at the moment I'm enjoying. In terms of books, well, my favorite author is John Irving, and his probably classic piece is The World According to Gar. And if you haven't read it, it's a bit of a long read. It's surreal. It goes through all sorts of emotional and psychological trauma, and it's not quite reality, and yet there is, and you can see where he's come from. A lot of it's based on his growing up. So John Irving, The World According to Gar, brilliant.